You just time traveled to 19th century London and broken your leg. In the dank operating theater, there's no anesthesia, only burly attendants pinning you down while a butcher-like surgeon wields a bone saw. Robert Liston, the fastest knife in the West, could amputate a leg in 2.5 minutes. Yet his record carried a grisly 300% mortality. Patients died of sepsis, assistants bled out, and a spectator once dropped dead of shock. This was orthopedics' dark prehistory, where agony and infection were inseparable. Then, in October 1846, Liston stepped into history, performing Europe's first public ether-anesthetized surgery. He calmly let his patient inhale ether vapors, cut with steady hands, and watched him awaken pain-free, better than any hypnotist. He later boasted, ushering in the era of painless operations and spawning a worldwide rush to adopt anesthesia gases. But anesthesia only spared you from the scalpel. It couldn't banish infection. Inspired by Pasteur's germ theory, 2 decades later, Joseph Lister observed closed fractures healed, while open ones, bone-piercing skin, proved fatal. He sprayed instruments, hands, even the air with carbolic acid. Mortality plunged from nearly 50% to under 15%, birthing antiseptic surgery and transforming ORs into healing sanctuaries. Having solved how to cut safely, surgeons next asked what lay beneath the flesh. In 1895, Wilhelm Röntgen discovered X-rays while experimenting with cathode ray tubes. He placed his wife's hand before a detector plate and saw her bones and wedding ring etched in ghostly detail. Within months, battlefield hospitals used X-rays to map fractures and locate bullets, granting doctors revolutionary X-ray vision. The 20th century's wars forged rapid advances in bone repair. In World War I, the simple Thomas splint, a metal frame cradling the leg, cut femur fracture deaths from 87 to 20% by immobilizing the injury and reducing shock. Plaster casts and traction became routine, letting bones knit with minimal movement, though long bed rests still brought muscle wasting, bed sores, and pneumonia. Surgeons soon sought full functional restoration. Early implants, silver wires, ivory pegs, even glass rods, all failed. Rejection, corrosion, and infection doomed them. Mid-century metallurgy delivered stainless steel and titanium alloys. Thus began internal fixation, contoured plates anchored with screws and intramedullary nails threaded through marrow canals. These hidden scaffolds held fragments in perfect alignment, letting patients bear weight sooner, avoid muscle wasting, and start active rehabilitation programs weeks sooner than ever before, regaining strength and mobility through guided physical therapy. Surgeons now use computer modeling and AI-driven planning to optimize implant design for each individual, reducing complications and speeding recovery. Orthopedic goals shifted from growing bone back to restoring function, most dramatic in spinal surgery. In the 1960s, Paul Harrington pioneered long rods and hooks to straighten scoliosis. By contouring metal implants to patient anatomy, he achieved curvature corrections previously deemed impossible. Today's surgeons use pre-bent titanium rods, pedicle screws, and real-time imaging to tailor precise, lasting adjustments with minimal incisions. If internal fixation was repair, the next revolution was replacement. For arthritis sufferers, life was unending agony until 1960, when John Charnley debuted the modern total hip replacement. His polished metal femoral head, high-density polyethylene cup, and bone cement synergy let countless bedridden patients walk again. Within a decade, knees, shoulders, and elbows gained factory-made, joints refined with ceramic bearings, modular stems, and cementless fixation, now lasting decades and returning independence and quality of life to millions worldwide. But what if an entire bone segment is missing? In 1668, Jaap van Meekeren grafted a dog's skull into a human cranial defect, and astonishingly, the bone fused. After World War II, organized bone banks emerged, preserving cadaver grafts, or allografts, to fill critical defects, sterilized and shaped to match each patient's needs. In the early 2000s, molecular biology unlocked bone morphogenetic proteins, BMPs. Recombinant BMP2, coated on collagen sponges and implanted into defects, ignited robust new bone formation in weeks. We had moved from transplanting bone to engineering bone. Today, bone is humanity's second most transplanted tissue after blood. In labs worldwide, researchers 3D print living bone, extruding stem cell, laden bioinks in layered patterns, then nurturing them in bioreactors that simulate blood flow and mechanical forces. Early clinical trials target craniofacial reconstruction, long bone defects, and spinal fusion. One day, crafting fully living, patient-specific replacements on demand. On the horizon lie nanotechnology and smart implants, antimicrobial coatings that release antibiotics when infection strikes, and sensors embedded in scaffolds to monitor healing in real time. Gene therapies for osteogenesis imperfecta and osteoporosis promise to correct genetic bone disorders at the source. Bioprinting may soon layer bone, cartilage, and vasculature to create whole joint constructs in vitro. Engineers, biologists, and clinicians now collaborate to push skeletal care beyond mere repair toward enhancement, regeneration, and possibly even augmentation of human capabilities. Yet all this innovation begs a deeper question. What does bone truly mean? Evolved to let us stand upright, wield tools, and build civilizations. Our skeleton shields organs and brain, yet binds us to aging bodies. Your 206 bones are silent witnesses to every triumph and fall, every wrinkle etched in calcium. When flesh decays, they'll be your final testament to the earth. But more than relics, they're living tissue, sensing, adapting, and repairing. Because of your bones, you can run, jump, touch, and love. They are living proof you still breathe. As long as they hold up your smile, chase a sunset, or embrace a loved one, life's drama goes on, unceasing, unstoppable.